Hello, this is Dr. Ahmed, and I like to talk about travel or air travel when you're elderly. Before I start the talk, how about I tell you a story of one of my patients. His name was Frank. One time he came to me many years ago and asked me whether he can fly to Paris. I asked him about the reason for it, and he says, I like to take my wife and I like to go to Normandy, where I landed on June 6th, 1944 as a young man. That is one of his bucket list to do. I thought, why not? And then I said, well, let me go over your medical record, because he has some heart issue and history of congestive heart failure, but is stable for a while, and also has atrial fibrillation. Not all the time, it's a paroxysmal atrial fibrillation. So after going through his record, I told him, Frank, you can go. He was very happy. And he went and he came back and he was happier and thanked me for letting him go. Sometimes it's important that I do things, or we do things which is important. As we are all getting older, especially the baby boomers who were born between 1946 and 1964, their age is now between 57 to 75. They worked very hard, and some of them have retired, and they want to do one thing, that is travel. They want to go to other countries. Sometimes they just want to travel in United States. These baby boomers now has the money, time, and the bucket list, and you expect them to travel. For the last 2 years, because of COVID situation, travel has been cut down to minimal, and we expect that in next year or two it will just boom. People will fly all over the place to catch up the lost time. Few factors that will limit our travel. One is finances. We expect that a lot of our baby boomers will have good saving and job responsibilities, or if they are still working, and also health limitation. I will try to keep my discussion in that health limitation part of it. Otherwise, it will be a very long one. There is 3.9 billion air travel happens every year. That's a lot of people. And there is 44,000 in-flight emergencies. Most of them are not serious. This emergency is usually because of the change of atmospheric pressure. Oxygen tension in the airplane is lower. Usually they keep it for as if you're flying at 8,000 feet, but sometimes we fly at 30,000 feet. So that creates a problem. This 8,000 feet pressure system came up after the Second World War, when the airplanes were flown and all the flyers were pilots and extremely good health. So if you count how many emergencies happens, that will be 1 in 640 flights, and out of that 12% are respiratory issues. Death rarely happens, but it's not zero, and that is very good statistics that way. Not too many people die in an airplane. If somebody comes to a doctor and asks, do you think I can fly? And it's not a straight cut answer, yes and no, because you have to know whether he has or she has some medical issues. Usually the problems that happens is very simple, like jet lag that can happen as you cross time zone. There is an issue of high altitude and the heart, issue of the blood clot in the leg, and we call it DVT, and also somebody has a chronic lung disease and whether he or she will need oxygen. According to Department of Transportation, airlines are not allowed to discriminate on the basis of health problem. They should try their best to accommodate so that somebody can fly. So if somebody needs an oxygen, the passenger may need to spend some money to accommodate that, but he or she will get it. But airline will ask them to get a certificate from a doctor to make sure that they will not be an hazard in the airline and halfway. They fly pretty high. It's almost 30,000 feet, 35,000 feet. If you look at the height of the Everest, which is 29,000 feet and some more, the tallest mountain in the United States is Denali in Alaska, which is at approximately 20,000 feet. Now, I like to talk about some specific issues, health issues. Like if somebody had a stroke and recovered very well, they should at least wait 2 to 4 weeks before you plan to travel. If you have a migraine because of change of atmospheric pressure, migraine can be triggered while you're in flight. It is very important that you continue to have your prophylactic medication that you take to control before you fly. Another thing is a seizure. If you had a seizure within 1 month, you should not fly, because airline is not a good place to have a seizure. Sometimes sleep deprivation can trigger it, and it is best not to drink alcohol, because alcohol will decrease your seizure threshold and may precipitate one. As I have already mentioned, that 12% of all in-flight emergencies are respiratory in origin, and problem can happen with patient with COPD or chronic lung disease. It is important that you check your O2 saturation or oxygen saturation with a pulse oximetry. If your O2 saturation is less than 85, probably should not be flying, and be evaluated whether you need oxygen, because as your surrounding atmospheric pressure will drop, your oxygen will drop too. If you're already on oxygen and you're taking less than 4 liters, then probably should increase by 1 liter more when you are flying. But you have to inform the airlines that you need oxygen, and they'll supply you for a fee. If you are already known to have bullous disease of the lung, then you should be worried about pneumothorax, and you should talk to the doctor before you fly. Next issue may be DVT. They say between 2 and 5% people may have blood clot in the leg if you were flying over 4 hours. Aim is to get up and walk around, or you can use a graduated stocking for some protection. There's some risk factors for those, like if you are obese, if you have a varicose vein, age over 40, some sort of cancer, or if you are on a contraceptive pill. These are at-risk people. So you have to be careful and take extra precaution of stretching your leg and getting up and walking when you can. There is few other issues like pregnancy, although it doesn't apply to geriatric population, but if somebody is pregnant and gestation period is over 28 weeks, airline usually restricts them. And issue of infections control, like a corona vaccine, and also have to make sure that you don't have a TB. They may ask for that type of report if they suspect. Then other issues like coronary artery disease. That's a big thing. If you have a coronary artery event like MI, or you had a bypass graft within 2 weeks, probably you should not fly. And I'm sure doctor will tell you not to fly. If you have a decompensated congestive heart failure, that's a wrong time to fly, as expected. If you have a pacemaker, it is safe. You can fly without any problems. There's the cardiac issues. You have to worry about arrhythmias, because with hypoxia, something bad can happen. There's some contraindications, but it's not cardiac issues, like severe sinusitis and nasal polyp. If you have anemia less than hemoglobin less than 8.5, you may feel dizzy. To summarize, take your medication in your carry-on bag, because sometimes luggage gets lost, and it's not that frequent, but why take a chance? Keep a list of your medication. If possible, write down the generic names. If you're flying to a different country, they may have a different name for the medication you're taking in case you need it. To avoid deep vein thrombosis or DVT, try to walk when possible. You can use a stocking or compression stocking to decrease the risk. Taking aspirin is not shown to be helpful. Only reason you take that is in case you have risk for stroke or coronary artery disease. If you need an oxygen, let the airline know beforehand so they can arrange it, and they will give it to you for a fee or charge. It varies between $100 to $1,000 depending on the length of the flight. And if you're planning to go to overseas, make sure that you check CDC site to see whether you need some prophylaxis or vaccine, and because some country will need that. And If somebody has issue with the memory, make sure that they don't get too confused. It's possible because the change of place, environment, noise, sleep deprivation all can trigger confusion and agitation. So there's something you need to be careful. Sometimes you hear that patient got very agitated or passenger got very agitated. I don't know why, whether it's alcohol or some sort of psychiatric issue. If you need any help in the airport, they are always willing to help you. If you need a wheelchair to transfer you from one place to other, they'll more than happy to do that, and that is part of their service. So don't hesitate to ask if you need some. And that's all. Thank you.